This is Steve Zeltzer with WorkWeek, and I'm here with two activists and unionists with the City and County of San Francisco and have been active in the front lines fighting for health and safety. Brenda Barros is with the Department of Public Health, City and County of San Francisco, and chair of the General Hospital chapter. And also joining us on WorkWeek is Thornton, who is also a healthcare worker in the community centers and is the vice chair of the community healthcare chapter in the City and County of San Francisco, SEIU 1021. Welcome, both of you, to WorkWeek.
Welcome. Thank you.
Hi, thank you, Steve.
So maybe you can talk about what's going on. We're now a couple of months into the pandemic and the situation of healthcare workers in San Francisco, and you're still apparently struggling to get protection and make sure that you and your members are safe in this very dangerous crisis. Brenda?
Yeah, that is true. A lot of people feel like they don't have the equipment they need, or if they get it, it's only one. A lot of people are worried about what people are doing when they're not at work. When they come into work, the exposures that people have had, because some of us see people as soon as they walk out of the door. When they're in the building, they have a mask on, but as soon as they walk out of the door, they take it off. So we don't know how safe we are, and we think more stress needs to be put on educating even people who work in public health about always having a mask on. I don't think the public in general, and I think people are starting to get tired of wearing masks, and so people are starting to be a little sloppy sometimes. And that's putting us all at risk.
And Cheryl?
Well, what I've seen is, first of all, the only thing we have is surgical masks. We do not have PPE. A lot of us are working in sites where people are coming with positive corona. So recently, as late as Friday, we've been asking our union to, they've been advocating for more masks. I think right now there's a campaign, Protect All. But recently, our union received masks and distributed masks to 2,000 of the members, whereas there's, I don't know, in San Francisco, I guess there's 20,000 members. So people, frontline essential workers like myself, black and brown, we didn't receive any masks, any PPE from our union. So we're still trying to look into finding out why some people got it and others did not.
Yeah, Cheryl is correct on that, because a while back I heard the story on the news that SEIU, our mother union, it was supposed to be buying a bunch of masks. And that there was some weird thing that went on with the shipment from China, and the FBI was looking into it, and so they never appeared. But then we never heard anything else. And at none of this time did we hear anything from 1021 about we're going to get masks, or we have masks on the way, or when we get the masks, this is how we're going to distribute them. Nothing. The first I heard about it was a rally in front of One Van Ness with our president of San Francisco, Teresa Rutherford, on it, saying we have PPEs. And so when I saw that, I was off work. But when I called my workplace, nobody that I know has gotten a mask. So I don't know how they decided who was going to get masks. A lot of people are feeling like if you aren't going to get masks for everybody, why are you just giving it to some people? So there's a big problem with that. I don't know if they're going to get more. I mean, the communication has not been good.
So I just want to add to that, okay, Steve. I just want to add one comment. I feel like if you don't do a first come, first serve, and you do, I don't know if they prioritize the mask, but if you don't do first come, first serve and make it transparent, you're deciding who's worthy and who's not of these masks. And, at any one time, any of us could get sick. We're on the front lines. There's been no assessment of who did what in order to distribute these masks fairly or, prioritize them. So I'm pretty, I want more. I want to find out why our own union has decided to only give masks out to certain people.
And, there's a long history of kind of PR rallies, PR protests, but it seems like in this case, the union leadership of SEIU 1021 did not contact the chapter presidents, like at General Hospital, community healthcare centers, and talk to them about the distribution of these masks. Why wouldn't they contact the leaders, the rank and file elected leaders of the different chapters, and ask them what their needs are?
What I feel, Steve, is there is a lack of communication, like I said. I mean, even with what we're hearing coming from City Hall, we have a full elected bargaining team for the people who work in San Francisco. The nurses have a bargaining team, and the miscellaneous, which is my group, has a bargaining team. Elected people to represent them. The union has taken the position that only a handful of people, which are all at the top, are going to do all of our bargaining around COVID. And, you know, I've talked to members in other chapters also. Everybody is wondering what is going on. Why are we not being allowed to make these decisions for our members, especially when they keep spurting things like, well, you know, there's going to be layoffs. Well, you know, the cost of health care. Well, this is happening. But then again, they're not putting the duly elected body that the members put their trust in to negotiate things for them. They're just being totally left out. And that, I think, is wrong.
Yeah.
Well, as far as communication, Steve, I just want to add one point. No one even try to ascertain who had an underlying health condition, who should have the mask first, based on medical conditions. None of that went on. We just don't know how, like Brenda said, the communication is not there.
Well, this may be could be a life and death situation for frontline healthcare workers in San Francisco. Do you think it's negligence on their part that they actually haven't gone to the rank and file, the chapter heads in these different departments to find out what's going on? How are they getting information about where the need is? And for that case, both the city as well.
Well, they have really they set up this structure now that I was told about. I wasn't asked about it. I was told about it. Basically, they're allowing the city to pick who they are willing to talk to, number one. Secondly, that everything has to be funneled up to that same group of people that I just told you about that are negotiating, 3 or 4 people.
And who are those people?
It's, from what I heard, it's Josie Mooney, who's an employee of the union. The person that's over San Francisco, Jason Blum, he's also an employee of the union. There's Teresa Rutherford, and then there's the president of our union that I know about, Joseph Bryant.
So they've taken...
who else they're letting in the room, but we don't know who they're letting in the room. But those are the only ones I know, because I was told by the city that's who's in the room. That Mendez wasn't in the room.
I see.
He wasn't one of the people they said was there. But I'm sure through the Labor Council, he is negotiating with the city.
Well, we know in the last economic decline in 2008 that leadership of the Labor Council and the leadership of the union said that public workers have to take cutbacks, that the reason for the crisis in public services because of public workers. And as a result of that, there were concessions made as far as health care and as far as pension costs. There was cost shifting going on. What is your concerns now with a budget crisis and with a situation?
Well, my concern, Steve, and I've voiced it to a lot of people, and I started a long time ago voicing this because I see the cards coming. I'm watching the game that's being played. I see how we're all public sector workers. On one hand, everybody's praising us, everybody's thanking us for coming to work, doing what we are for people. You know, they're sending food out to the hospital to feed us. They're doing all these things. But then on the other hand, there's this underlying current of people that have been there all along. You know, Sean Ellsberg is still in London Breed's office. He was the orchestrator of this thing the last time. So a lot of us are seeing the same game that was played when Newsom was mayor, you know, the same verbiage even that was used back then. Of course, they've added COVID because COVID wasn't here back then, but it was another crisis. But I think that they want the same people that they're praising to bear the brunt of all of this, and that they want to take it off our backs. And they're going around spreading rumors. Nobody hears anything directly from anybody. People who are going to the mayor's meeting are, London wants to cut it, and saying that, you know, we're just getting too much. You know, the pension costs are too much. Just really negative things. I don't know if she's saying it or not. I hopefully, I don't believe she is. But I think that that's what they're telling us, because they're setting it up so that they're going to have people so terrified in a minute that they're going to be willing to give up anything to avoid all these millions of pink slips that they say are coming. And so it's the same game plan I saw the last time. I'm seeing the same thing work its way out again. The same way. The Labor Council's actions as of late are feeding into it too. So, you know, it's unbelievable that, you know, they screwed us once back then. We never recovered from the last time. And so now I see it coming again. You know, I'm one of the people that's fortunate enough to where I'm going to be retired, but over their working lifetime, people are losing all kind of money that they should have had to take care of their families. And it's not that they're being given anything. People work their asses off for the city. We're all working short staff. We're all doing the work of two people in most places I know. I don't know what places they are. Maybe up in upper management they're not, but that everywhere I know, that's how it is. And to want to take stuff from us at this time, I think is outrageous. When you got all these rich people living in San Francisco that are not paying their fair share. I mean, it's happening in Los Angeles. You know, I think the mayor of Los Angeles went and had a talk with a few people, and they, you know, these rich people started coming out of their pockets to help pay for things. But in San Francisco, the wealthy people are just very selfish, and they handpick and they nitpick, and they'll give a little here and they'll give a little there, but they're not willing to make any kind of major sacrifice to help the city. But they always want us to do it when they're the ones getting the tax breaks. They're the ones who the land was given to them cheap by the city. They're the ones that have gotten all the breaks and made all the money. They're the ones that can afford to still live in the city. Most of us who work for the city cannot. So I just think it's outrageous if they come after us again for that money. And my fear is they're going to put some crap on the ballot again, and the public will be fooled and vote for it again.
And are these union officials like Josie Mooney saying that the billionaires, or 74 billionaires in San Francisco, should pay for this economic crisis? That's the problem, Steve. We have no idea what they're. Well, have you heard? Have you heard Cheryl?
We have no idea what the union has agreed to stand down on. We have no idea is the problem.
So I did hear this. I did hear London Breed say the 75 billionaires in San Francisco need to help with the economic recovery of San Francisco. That was an article on Facebook. So that's what I did hear. But going back to what Brenda's talking about, we're already hearing, Steve, from upper management, there's going to be layoffs, closures of programs. Yet, we haven't even gotten to that point. And we've also heard it from our union. They haven't even tried to figure out if there's another way to do this, how we're going to do it. Everybody is just running around already saying layoffs, layoffs, layoffs. And it seems like the layoffs are going to come from the essential workers, not the frontline workers. When I say frontline workers, not the clinicians, the nurses, the MEAs, people like that. It's going to come from eligibility, clerical, people like that are going to be, they're already talking about laying off.
And should the union take a position that there not be any layoffs and cutbacks of members, but the billionaires, there could be a wealth tax on the billionaires in San Francisco. You have some of the wealthiest people in the world who live in San Francisco. There could be a payroll tax for people making over $200,000 a year. That's something the Board of Supervisors could pass immediately to say that the rich are going to pay for this crisis. Should the unions be demanding that?
What I think is, and this is what I believe, and it goes back to what I was telling you before, Steve. I see the same game plan that's happened when they attacked our pensions. I see that coming again. And what I think is that while it doesn't matter if a union is out on the street saying, oh, no cuts, no layoffs, no layoffs, no layoffs, if in order to get that, they've already made a deal behind the scenes to give up your livelihood in order for there to be no layoffs, without having the full bargaining team making decisions on things like that. And that's what I'm upset about. If the whole bargaining team got together and we decided, yes, we don't want our coworkers laid off, then that would be different. But that's not what's happening, and that's not what I see playing out. I'm saying the decision is being made, and it's just being dumped on us. And they're only talking to certain people, and they're not using the mechanisms in which unions should be making decisions, which is their full, duly elected bargaining teams, and they're taking the stance that we are the elected leaders, so we know best, and we should tell you what to do. And I totally reject it, and I think that's part of the problem.
It doesn't sound like a very democratic structure if they are unilaterally making decisions.
It's not democratic. I mean, most people I know, if you talk to them in private, will say that it feels like our union, 1021, is becoming a corporate union. And it's not. They say that the motto is member-driven, member-run, but we ain't seeing much of that member-driven, member-run.
No, all we're seeing is top-down decisions that are just coming at us. We have no idea, just like those maps. Top down.
And I'm a pro-union. I'm not one of those people that believes in desert. I ain't trying to desert, but I got to call it what I see. And right now, things are not working properly. The membership is being left out. We're being dictated to. Even when they have a town hall, like the last town hall they had like, you can't say anything. It's just them talking at you, but they're saying it's a town hall, and they're going to say all these people on the line because we called in, but they're not going to say, well, all we did was just tell you what we thought, and not really listen to what you're saying. No input at all from the membership. Them just talking at us. Now that kind of behavior for a union is outrageous, and it shouldn't be happening.
And the other part that is a problem with the town hall meetings is your questions are kind of censored, because there's a person that takes your questions, and they'll decide if they're gonna ask your question. So if they don't like your question, then it's censored.
So rank and file participation is really limited, and voices are limited. There's a chat on Zoom. They could take chat. A lot of people could contribute to the discussion. I guess they're afraid of members asking some questions that they can't answer.
Well, I think they know what's coming. They know people aren't happy. If you talk to them, they know people are unhappy. But their feeling is that we're doing everything that we can. We're trying as hard as we can. We're fighting, and the only way we know to fight for members, and what some members are saying and have been saying for quite some time, this is not new just when COVID, even before COVID, people were saying it, is that it's just not good enough what you're doing. And the reason it's not good enough is because you're not including us enough. That's why it's not good enough, because it's just based on your personal opinion, not on what we, the collective, think. And that's the downfall from the way things are happening right now. And that's why it's hard for them to get people to turn out to rallies. That's why it's hard. It's hard to get members to do anything. That's why people are dropping out of the union, because that is happening. That's why they're in this thing now where the only thing they seem to be concerned about now is organizing new people. It's because they know they're losing some of the old ones. And they have to organize these new people to keep it going.
Basically, we're getting new members, but not defending the members you have. You feel?
Exactly. So that brings up a point, because SEIU 10-1 just recently organized Health Fight 360 into our union. And that is our direct competition, and I just don't understand it, because our network has lost over 50,000 patients to Health Fight 360. Therefore, jobs are going out the door, and I don't know how you represent both without a conflict of interest. I don't understand how.
Well, do you think that this outsourcing and privatization through Healthcare 360 is a form of union busting? Because you're basically having Healthcare 360 do the same work public workers do at much less pay and benefits?
No, I don't think it's union busting. What I think it is the union showing its way toward the non-profit side of our union, right? So, the nonprofit members and everybody else, is a lot less problems for them than the public sector workers. We're much stronger, I would say.
Isn't that union busting if you outsource
members.
it?
Our leadership people tend to be stronger, and it's a lot harder for them to persuade us into stuff.
But
from what I see for the nonprofit side of things, because they're usually lower paid, like you said, they're happy to be in a union. I'm sure Health Right 360 is happy to be in a union. I'm glad they're in a union. I have no problem with that. But when the people who run the union start playing sides, one group against the other, and telling people, oh, we're all brothers and sisters, but then you're not treating everybody that way, that's a problem.
Well, shouldn't public workers, if you do public work, be paid public wages? It seems if you're doing the same work as another worker and they're paid...
You know, there was some deal cut. Just like I said, all these deals keep getting cut, Steve. We have no idea who cut them. We don't know who's in the room. We don't know what was said to who. But all I know is Cheryl saw it. I saw it. I saw the move toward trying to get Health Right 360 in the 1021. We all saw it.
So
that's exactly what happened. And it was very secretive, and they weren't being open and honest with everybody. This is where we're going. Nothing. As a matter of fact, they just blatantly lied in a meeting, one meeting I was in, when they were asked directly, is that what you're doing? And they said, no, we're just helping them. Okay? But that was a blatant lie. They knew at that time that they were organizing Health Right 360 to become a part of 1021. Now, I don't have anything against those individuals. I have no problem with that, but these are the kind of dishonest, secretive, behind-the-scenes, sneaky people do that makes me not trust. I can't trust somebody who, when I ask you a direct question, can't tell me the truth.
So, Steve, I think my perspective is what I've said to SEIU 10-1. Every year people retire. We're losing requisitions. We're losing positions. We can see our workforce is shrinking. Every year we don't have enough workers to complete the work. As Brenda says, sometimes we're doing the work of 2 or 3 people. And I don't see that our union is fighting back, asking for more requisitions. And Health by 360, meantime, they're coming up, they're expanding, they're growing, they're opening clinics, and they're taking patients from the network. So I just see that this is a downturn for public workers. That's what I see. I see that, in a way, public workers are being phased out for these nonprofit workers that you don't have to pay a pension to, that you pay very little benefits to, that they make a third of what a public worker makes. And they don't really have to even follow all the discrimination laws because they're a private entity.
And
so that's problematic.
And have you gotten a copy of the contract of Healthcare 360 to see what the pay salaries are?
No. I've never seen it.
So they actually have a contract with, who knows, hundreds, maybe thousands of workers in SEIU 1021, and they've never showed that contract to the other members, the other leaders in San Francisco. Is that what you're saying?
Yes. No, I've never seen it.
So they're keeping this Healthcare 360.
I'm a co-chair. I'm very active, and I have not seen anything in writing about that.
So you're saying...
The only thing we heard was after the fact that, they voted to join the union, and now they're part of 1021. That's all I heard.
So you're saying that jobs are leaving the public system, and they're going to a nonprofit that has a union contract with SEIU 1021, and Joseph Bryant and Josie Meany and these people are keeping the contract a secret? Is that legal?
Well, I know I have not seen it. Now, have I asked for it? I haven't asked for it. But I have no doubt that they're not going to share that with me. I mean, we can't even yet find out. We've been asking what the contract is for UCSF, how much money that is. The city will not give us that information. We've been trying. I ask all the time. I don't know how much money is in the UCSF contract. I'd like to know how much money is in the Health Right 360 contract with the city, because that's what it is.
Well, these are tax dollars. These are tax dollars, public dollars of the people of the city and county of San Francisco. Shouldn't we have a right? Shouldn't we have a right to see those documents?
Absolutely.
I think the residents of San Francisco through Sunshine would be the only ones, and I know some that have tried, and they still can't get the number. That's just, I think that number is so large, nobody will ever release it.
And doesn't that allow the possibility of nepotism and corruption when people don't know where the money's going?
Absolutely.
And well, it could.
I mean, if you don't know where the money is going...
Anytime people aren't transparent, who knows?
And
they could be doing all the right things, but we don't know it because we can't see the proof one way or another.
And if
well, what we would like to see is our union to be transparent and show us where the money's going. I mean, all members should know. We're all due-paying members. We should know where our money's going. We don't. We have no idea which direction our union's headed. We have no idea.
And especially if it's the case that they're outsourcing jobs, many of public worker jobs to this nonprofit Healthcare 360, and you can't even get a copy of their contract. If their positions, their job classifications are paid 30, 40% less than a public worker, that's an incentive to outsource, to get rid of all public workers. Isn't that an incentive for the city to say we don't need any more public workers?
Well, see, the fear that we have as public workers, particularly those who work in clinics and do the same work as Health Right 360, is that it's going to have the reverse effect. And we're going to run into a situation where the union has union members who are in Health Right 360 doing certain work, making this amount. People that work for the city are making more, doing the same work. What we fear is it's going to turn into an environment where the union will try to stifle our wages in order to bring those people up instead of the other way around. And that's what we've seen happening, with the descaling. That's how that happened. A lot of things got farmed out to nonprofits. Then all of a sudden, well, we're paying all our clerical people too much. Why? Because the nonprofits are paying their people so little.
Isn't that
we don't want that to happen.
Isn't that union busting? Isn't descaling union busting?
Yeah, that was part of it.
And who supported that in the union?
I say the descaling, it was Gavin Newsom. Now, I'm putting this fair and square on his shoulders. That's who I hold accountable for it, because he's the one that made the decision to do it.
And descaling what is that exactly?
Well, that's where, say like somebody is a middle class worker and lower middle class, probably more likely. Say they were making like $50,000 a year, right? They would do something like, some of those people, they got their salaries cut 20%. They all got pink slips in the mail, so they had to go through that trauma. And then they got called back and say, well, if you want to keep your job, then you take this job that pays 20% less, or you're unemployed. And, of course, people are going to take those jobs because they don't want to be unemployed. But I think it was so horrible that they did that to those people. And that should never, ever, ever happen to anybody again, because that's outrageous. But, those are the kind of things people are hearing.
And what can SEIU...
Now, we don't know if it's true or not because we're not at the table.
And what can SEIU 1021 members do about this? Because you say that you feel you're being sold down the river, basically, by the secret structure, by secret negotiations, by no report to the rank and file, by no participation of rank and file elected leader. What can the members do? And what should they do?
Well, I think all we can do right now is start pressuring them to get the full bargaining team up, and that's it. And there shouldn't be no more negotiations without the bargaining team elected by the membership, the people they trust, sitting at the table doing it.
Okay, well, I want to thank you very much. We've been talking with Brenda Barros. She's the chapter president, SEIU 1021, at San Francisco General Hospital, which is probably the largest unit in the city and county of San Francisco. And also Cheryl Thornton, who is the vice chair of the community healthcare centers and is a healthcare worker who also has been retaliated against for fighting for PPE and other health and safety protections. So thanks for joining us on WorkWeek.
All right, thank you, Steve.